The interview that said too much and yet too little, Ethiopia's crumbling health system exposed on national TV. On May 12, 2025, Dr. Meets Daba, a senior representative of the Ethiopian Ministry of Health, appeared on the EBC Amharic program to discuss what was framed as recent improvements in Ethiopia's health sector. The interview began with optimism, celebrating policy updates and infrastructure projects. But beneath the surface of official language and carefully measured claims, the broadcast unintentionally offered a window into a public health system cracking at its core, especially in the most neglected corners of the Ethiopian empire. 1. A healthcare system in policy paralysis. Dr. Daba referred to Ethiopia's 30-year-old health policy that was once hailed for its focus on preventive care. She acknowledged a shift toward a more integrated health system, but stopped short of addressing how this evolution has failed to reach the people who need it most. Oromia, the largest region by population and geography, remains the least served, with massive disparities in access, infrastructure, and health worker presence. While the Ministry of Health celebrates policy reforms, there is no clear implementation framework for rural communities living through war, displacement, or economic collapse. A policy without delivery is not reform, it is performance. 2. Oromia, the epicenter of health neglect. Every meaningful health metric, maternal mortality, child malnutrition, infectious disease outbreaks, rural hospital coverage, water sanitation, and access to professional care, shows that Oromia is the most acutely affected region. Yet, this was not addressed in depth by Dr. Daba. Nor was the impact of ongoing military operations, mass displacement, and restrictions on humanitarian access, all of which directly undermine the healthcare system. Dozens of clinics have been destroyed or abandoned in western and southern Oromia. Dozens of clinics and health posts have been destroyed, looted, or abandoned in western Oromia, and critical health infrastructure remains severely disrupted in several conflict-affected zones. Health services in Guji and Barina, southern zones, are also reported as severely affected. Health professionals are unpaid or under political suspicion, facing threats for doing their jobs. Ambulances are rerouted or blocked, and patients in remote areas walk hours or days for basic services. 3. The most underpaid health professionals in Africa. Empire Ethiopia is home to some of the most underpaid health professionals on the African continent, particularly in public service. Empire Ethiopia's general doctors currently earn between $121 and $183 per month, nurses typically earn $51 to $79 per month, and even specialists rarely exceed $279 per month with current exchange rate, figures that are dramatically lower than in neighboring countries such as Kenya, Rwanda, and Uganda, where doctors and nurses earn several times more. With the black market exchange rate surpassing 130 birr per US dollar, the real value of these salaries has collapsed. For example, a health officer earning 8,000 birrs monthly effectively brings home around $60, a wage comparable to unskilled labor in other African capitals. In Oromia, where infrastructure is crumbling and conflict is ongoing, health professionals often receive their salaries late, if at all, further compounding the crisis. These conditions not only fuel mass resignation and emigration but also reveal a government that values political loyalty over frontline care. While officials applaud the dedication of Ethiopia's health workforce, the reality is stark: dedication does not pay rent, and praise does not treat patients. Is it any wonder that doctors are striking, nurses are quitting, and new graduates are fleeing? 4. Training without retention, vision without trust. Dr. Daba emphasized the ministry's commitment to training health professionals yet failed to confront the mass exodus of doctors and nurses fleeing the country or abandoning posts due to insecurity and lack of pay. How can a nation retain professionals who are expected to serve without tools, salaries, or protection? Moreover, many are deployed to regions where the state treats the population as suspect, rather than as citizens deserving of care. This is not a system of healthcare, It is a system of survival politics. 5. Infrastructure without equity. The interview referenced ongoing construction of new health facilities. But data across Ethiopia shows a striking imbalance. Urban centers and politically loyal regions receive the bulk of funding. In Oromia, places like Benishangul Gumuz, Gambela, and southern Somali regions, health posts often lack clean water, power, beds, or essential drugs. Newly built facilities in Oromia's western zones are reported to be either non-operational or militarized. A building without access, staff, or trust is not a health facility, it is a facade. 6. The silence of community voices. Dr. Dabba briefly mentioned community involvement as key to sustainable healthcare. But what community voices are heard when journalists are banned, health unions are silenced, and grassroots health advocates are criminalized? Oromia's own health workers have repeatedly called for protection, fair wages, and autonomy, only to be met with arrests, suspensions, or state denial. 7. Legislation that avoids accountability. New governance frameworks were introduced in the interview, hinting at regulatory reform. But without independent oversight, transparency, or legal protection for whistleblowers, regulation in Ethiopia often means control, not improvement. No mention was made of the imprisonment of health professionals in war zones, the misuse of health budgets for military logistics, the lack of legal redress for patients harmed by systemic failure. 8. What wasn't said. Dr. Dabba spoke of improvements but never addressed the strikes currently paralyzing public hospitals. She praised training, but not the 5-month salary delays in Oromia and Oromia's Benishangul. She referenced education campaigns but ignored the absence of basic medicine in more than half the country's rural clinics. The interview captured the paradox of the Ethiopian health system, statistically alive but functionally comatose. 9. Final thought. The May 12 EBC interview, despite its official optimism, laid bare a sobering reality: the Ethiopian empire's health system is collapsing under the weight of war, inequality, and bureaucratic denial. Nowhere is this collapse more visible than in Oromia, where the people most in need of healing are caught between systemic neglect and political suppression. What they require is not more statements of intent, but a health system rooted in equity, accountability, and dignity. Until then, policy remains paper, and the empire's sick will continue to suffer in silence. Stay informed, subscribe for deeper insights, share this with your network, and help spread clarity where spin dominates. Informed citizens are the foundation of real change.